Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is, the Los Angeles Basin and South Channel Islands. Welcome, everyone. My name is Tiffany Lopes, and I'm the Director of Communications and Publications here at the UCLA Center for Health Policy Research. Thank you for joining us today for our California Health Interview Survey, also known as CHIS Data User Training. Today, our CHIS Data Dissemination Manager, Jacob Rosalez, will walk you through some significant updates to AskCHIS Neighborhood Edition, which is now in Tableau, as well as share some updates about AskCHIS. Before I turn it over to Jacob for the training, we want you to be the first to know that we have a date for the annual CHIS data release. Mark your calendars, Thursday, October 3rd, 2024, from noon to 1 p.m. Pacific time. Details about the release and flyers will be shared in the coming weeks, but for now, I'm going to drop the link in the chat to register and hold that date on your calendars.
Thanks, Tiffany. I appreciate the introduction. Like she said, my name is Jacob Rosalez. I'm the manager with the CHIS Data Dissemination, and let's move forward. So today we're going to do a brief CHIS overview and then a real quick AskCHIS demo, and that's essentially going to explain accessing AskCHIS platform now that we have a full CHPR center website redesign, and then we'll go into updates to the AskCHIS Neighborhood Edition platform. So the California Health Interview Survey is the nation's largest state health survey. It's a very comprehensive source of health information on Californians, adults, teens, and children. We have a robust range of health topics: general health status, health conditions, mental health, oral health, health behaviors, employment, access and use of care, health insurance, and respondent characteristics. This is a collaborative survey. It's funded by federal and state health agencies, and also national and California-based foundations. The survey, like I said, it interviews adults in the household, teens or adolescents, and then also children ages 0 to 11. Start with the screener interview, sample the children, interview the parent by proxy, and then the adult sampled, and then a sample of the adolescent as well. It's conducted in multiple languages: English, Spanish, Chinese, both Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. So with regards to methods, we wanted to reflect California's diversity. We have a very complex sampling plan, multi-mode data collection, both web-based and telephone. Like I said, language support. We provide custom oversamples as well as follow-on studies. So now we're going to go to a real quick demo on AskCHIS, and this is essentially focusing on the center website redesign and how you find AskCHIS. Just switch over to the browser. So here is the homepage for the Center for Health Policy Research. Quick way to find it is just go to Our Work, California Health Interview Survey, and this tab here, Access CHIS Data. And this allows you to access not only AskCHIS, AskCHIS Neighborhood Edition, health profiles, our public use files, as well as a special DAC request. So now if we just scroll down to the bottom, take me directly to the AskCHIS tool. And if you are having difficulty, you may have to register for an account. It's a very easy process. I already have my account. And you'll notice here, AskCHIS is essentially, it's the same way. It's currently on the center page. So you have all the banners with the center, and it's much more aligned with stylistic and color wise, but it has all the same features as previous. It's just, I wanted to let you all know that this is how you will access AskCHIS because of our website redesign. Also, for me, sometimes if I'm in a hurry, I just go to Google and type in AskCHIS or AskCHIS Neighborhood Edition, and it's going to shoot me right to that initial page where it says, take me directly to AskCHIS. Now let's move on and focus on AskCHIS Neighborhood Edition. So the updates to AskCHIS NE, big update was the census made changes every 10 years. They make changes to geographic boundaries. Census tracts get, there's new boundaries for census tracts, zip codes, and then you all know legislative districts. They get, the redistricting for congressional districts, state assembly districts, and state senate districts. Along with this update, we have updated 2021 and 2022 CHIS health indicators. Please note that our CHIS health indicators in AskCHIS NE are small area estimates. These are modeled estimates. These are not direct estimates from the survey data. As well as we have updated 2022 American Community Survey 5-year sociodemographic estimates. That's from the Census Bureau. Okay, let's get straight into the platform. And if I just go to Access CHIS Data, select on AskCHIS Neighborhood Edition. More information about AskCHIS Neighborhood Edition here, or I can go directly to the dashboard. We'll go directly to the dashboard. And you notice that once I'm logged in, I can access AskCHIS Neighborhood Edition. There's no need for an extra login or anything. Your login for AskCHIS is going to be good for you accessing AskCHIS. We have a getting started page with some quick video tutorials on creating your maps or creating your tables. Feel free to browse those and view those. I found those to be helpful. Let's go to create a map. The dashboard loads. And now you see here, in the previous iteration of AskCHIS Neighborhood Edition, the map wouldn't load right away. You'd have to select your indicator and your years and whatnot. And now we have it set up so that it just automatically loads. It's going to load the most recent year, 2021, 2022. It's going to show counties. It's going to be a health topic and asthma. That's just the default showing. And so functionality of the map, as you see here, as I hover over, I get a tooltip popping up showing me the name of the geography that I've hovered over, what year it is, what's the indicator name, what my estimate is, my 95% confidence interval, the population of the geography, and then some socio-demographic information, that being race and ethnicity and federal poverty level. If I click on Inyo County, you'll see here that I have these two data tables, one showing me what the estimate is for the state of California, and the other is showing me what the estimate is for Inyo County. I can change my geography by going to the select geography type dropdown. If I want to look at census tracts, my map will now display a chloropleth of the entire state of California by census tracts for 2021, 2022 asthma for adults. Now, one thing you'll notice with the census tracts is that these are like, especially down here in the Los Angeles region, they're just very, very small. So they start scrolling in deeper. You'll see that the census tracts are very small. Some tools that you can use to whittle down and zoom quicker are, you have this search map lookup tool. So if I wanted to look up a specific place in, say, Los Angeles County, say the city of Los Angeles, let's say West Hollywood. If I started typing West Hollywood, the map will automatically zoom to that region, and you'll be able to view the census tracts deeper into that region. If I wanted to go to, say, let's look at Oceanside, California. That's down in the northern part of San Diego County. It'll take me there. Anytime, if you just want to get the entire view of the entire state, just click on the zoom home. And it'll zoom out to the entire level. Another tool, we have an address lookup tool. This allows you to look up an address. Maybe you want to look up your home address or an address of interest, someplace that's in maybe a legislative district or health district that you're in. You can plug in your address. So I'm just going to pull up this address here. This essentially is the Santa Monica Pier. I'm going to submit on that. I'm going to copy it. I'm going to paste it in the search geography name. Hit enter. And it takes me straight to that census tract. If I want to compare it, essentially it filters it down. If I want to compare this my tract of interest to the tracts around it, just X out the name in the search geography name. And now I can get an idea of what the estimate is for adult asthma in this tract compared to the surrounding tracts. You also have the capability to group geographies together to create a custom geography, and it'll calculate what the estimate is for all those, for that custom geography that you created. All you need to do is select. So I'm going to select the Santa Monica tract, and I'll select some of the tracts close by. Hit the control button. And now you'll see that it's grouped those tracts together, and it's created its own kind of aggregate estimate of these 3 tracts that I have grouped. That's just one way to do a grouping. You can also go into this tool. We have a lasso tool, we have a radial tool, and we have a rectangle tool. If you select the I prefer the lasso tool, but I think it's kind of up to people. So maybe I want to select like all of these tracks. I can draw this lasso. It will group them all together. And you see here, it's created my aggregate of this custom boundary this custom geography that I built. So I see here that in this, my user defined geography, 17% of adults 18 and older have been diagnosed with asthma. We also have congressional districts, county, state assembly districts, state senate districts, and zip codes. These all work the same. You can group, with the grouping, you can only group one geography type together. So I can group different census tracts together. I can group different counties together. I can group different congressional districts, etc. together. I can't group a census tract with a city or a zip code with a congressional district. It has to be the same type of geography. So if you wanted to do this, say at the county level, this might be a good tool. I know a lot of times there's like regional regions of counties that are combined. And so you could say to your lasso tool, maybe make a custom Southern California, where I look at San Diego County, Imperial County, Riverside County, and Orange County. Combine those together, and I can get my estimate for a combination of all those counties. To get to the sociodemographic data, just go to the select a topic dropdown. We have sociodemographics, we have environmental factors, which is from the Cal Enviro screen, and then we have 4 or 5 different vulnerability indexes. Our sociodemographics, like I said, those are from the censuses. American Community Survey. These are the 5-year estimates. So I can look at Hispanic Latino adults. You see here in the select an indicator that gives you the menu of the different types of sociodemographic indicators you want to pull, or the health indicators, etc. This was the create a map view function. Now, if we go to create a table, this is where you start building your data table where you can export the data out. By default, it just shows the California estimate for asthma, for adults with asthma, 18 and older. I can select up to 5 different geographies with the state of California. So if I just want to go counties, there's just a multiple select dropdown. And you'll see from here, I start building up my table. You know, a real world scenario. Maybe I'm very Los Angeles focused because I live here in LA. What I would do is I'd probably say, I want to look at Los Angeles County, and then I also want to include, let's look at the city of Los Angeles. So here's you can type in as well if you don't want to go through the whole menu. You can type in, and it'll essentially filter down your drop down by anything with Los Angeles in. So I'm going to pull Los Angeles. I'm also going to look at Santa Monica. And I want to look at census tracts. I'm going to plug in that census tract that I had before. So now in my table, I have diagnosed with asthma, 18 and older. Give me estimates for California, Los Angeles County, that Santa Monica census tract, and the city of Los Angeles and the city of Santa Monica. I can add to this table, I can build onto it with the different indicators. I can add multiple years. And indicators as well. So now, as you'll see, I've built a pretty big table. Now, if we want to have a special, your custom group geography, what we can do is we can go back to my map. And I want to make a custom grouping based off of my census tracts. I'm going to go back to that Santa Monica census tract here. And just make my lasso. I've got my user defined. And now if I go back to create a table, you'll see that as I scroll down, I've created this table with my user-defined census tract geography. I can export my data, hit the export data button. And I will show you the output of my data file, my Excel file. This is all the results from the main table with the different geographies. You'll see here I have a notes section. It'll say unstable estimate. And then also if it's suppressed because of sample, because of population, we do a suppression by the population if the population is less than 1,000. My group geographies data, and then my group geography names. So these will tell me the names of the different geographies in the grouping. This is kind of hard to understand with the census tracts. You need to know specifically, but you can use the map to kind of like pinpoint where these are all at. When it says county, it'll obviously, if I selected, say, San Diego County, Imperial County, Orange County, it would say that, you know, San Diego County, Orange County. So that's kind of how you know, okay, these are the geographies that make up these estimates in my group geographies data. Please note, you can have multiple years in your table. You can have as many indicators as you want in your table. We do limit it to 5 geographies in the state of California in the table. As far as your user-defined geography goes, that can be as many different tracks as you want into it. There's no limit on the number of different geographies used in your combined geography. Again, if you want to have your user-defined geography exported as data, please remember that you need to do that in your Create Map section. And please note that once I've created my geography, once I click out of this, it's no longer here in this table and it'll no longer be in your other table. So just be mindful of your clicking. I recommend not clicking in the map once you've created your geography. Click outside of the map. And then you'll also notice that we provide in the address lookup, we provide the name of the congressional district, the assembly district, and the state senate district that that geography is in. You can see here in the drop down for the selecting geography type. We have these question marks next to the drop downs. If you hover over, it gives you information and instructions on using them. Also, please note for these vulnerability indices, I think they're in 2015, 2016. They're only available at the census tract level. kind of gives you that heads up. So if you try to, like I was before previously, I was at I think I was at congressional districts, and then I went to vulnerability indices, and then it selected indicator and said no items, and that's because we do not provide the vulnerability index at levels outside of the census tract. So if you're going to look at the vulnerability indices, please note that you have to be on census tract for anything to come up and for your map to generate. And that'll be likewise in the data table. If you want the vulnerability index to pop up, I select a vulnerability index. So I select my social vulnerability index. It'll be empty for everything except for my census tracts. Please note we have a contact field. If you have comments or feedback on AskCHIS Neighborhood Edition, we also see this in the AskCHIS platform. You can select contact us and provide us with any kind of feedback. Other things to note with regards to your address lookup, if you type in an address that is outside of California, you're going to get a pop-up saying, please enter an address that is in the state of California. So this is programmed to only allow you to view information on geographies in California, where we limit you. We don't want you to go outside of California because the AskCHIS Neighborhood Edition is focused solely on California, and we only have California estimates for those geographies, and those geographies that AskCHIS Neighborhood Edition supports are the state, the counties, legislative districts, those being congressional district, state assembly district, state senate district, zip codes, cities, and census tracts. Also, please note that census tract estimates are only available for the years from 2015, 2016, and forward. We started off AskCHIS Neighborhood Edition with estimates from 2011 and 2012 and 2013 and 2014. However, we did not support census tract small area estimates at that time. So you will not find anything for census tracts in 2011, 2012, and 2013 and 2014. Also, please note in the vulnerability indices, you will not be able to create any custom geographies from those, as well as the Cal and Virus screen. We allow for the custom geographies to create estimates for the health indicators, as well as for the sociodemographics. And that is the run over of the new AskCHIS platform. This is all generated through the Tableau system. And again, when you're using it, please send comments and feedback here. Okay, Tiffany, I think we can go to our Q&A now.
Thank you so much, Jacob. So we'll be going through the audience questions. If you have questions, please use the Q&A function in Zoom to ask them, and we will get to either as many as we can, or you know, if we end up ending a little early, that's been great for everyone. So let's start with the first question. How granular of geographic data before data for an indicator switches from survey data results to modeled predictions? When does data suppression begin to occur?
It's a very good question. So what we're using with the modeling is we're using the data coming in from the survey, and we're combining multiple years for these modeled estimates, the newest ones being 2021 and 2022. And with the magic of the model, we're utilizing sociodemographic data from Claritas data, as well as from the American Community Survey 5-year estimates. If you can send us an email at chis@ucla.edu, I can forward you some publications that we have regarding kind of the process for our modeling. It's complex. The granularity is essentially suppression that we're using is based off of the size of the population. So as I said previously, we're suppressing data when the population is below 1,000 for the geography. But as far as the modeling goes, there's a lot of matching, taking the individual survey responses, putting them in the geography, and then pulling in the sociodemographic data from Claritas and the ACS to kind of develop a predictive model on what the estimate will be.
Thank you. We had a similar question about the total. Someone says, when I go to AskCHIS, I'm confused about the totals listed for individual indicators. The totals seem much larger than the total number of individuals surveyed. If the totals do not correspond to the total number of survey respondents, then what do they correspond to?
Totals are we
I think the population totals.
So that total. So when you see population, perfect example here, because this can be confusing. But when I see population here, when I hover over it, it says 3,700. That is the entire population of this universe here. So I guess here, let me put it to a health topic real quick.
If you could also pull up regular AskCHIS,
yes,
because I think they also when you run a query, there's the totals there as well.
For sure. Okay, so just real quick. So this population, 2,800, this is the entire population of adults ages 18 and older. So essentially what this estimate is 20.5% of the population of 2,800 have asthma. And let me pull up AskCHIS. And here's a perfect example of just this is the quick and easy way of finding AskCHIS. If I just Google search AskCHIS, you see here I get the first pop-up is the very top of it is AskCHIS, and then right below it is AskCHIS NE. Straight to my dashboard here. Straight to general health status. And so here, this is the total population of California, because this variable is adult, teen, and child. So in 2022, we had 38,092,000. And out of that, 9.5 million reported excellent, 12.7 million reported very good health, et cetera, et cetera. So there is some differences with regards to what's going on there.
Thank you. Is there a reason why you only limit 5 cities at a time? What happens if we want to know the data for all cities in Orange County at once?
So the reason why is if you want to access more information on, say, hey, I need all the zip code data for this specific county, or I need all the census tract data for this specific county, we have individual data requests. If you're interested in those, please send us an email at chis@ucla.edu, and then we can provide that to you it is at a fee. But with regards to AskCHIS NE and what we provide, it's just limiting to the 5 different geographies.
Thank you. For geography types, someone asked if there's a zip code one in the available
Yes.
geography types. Can you just show?
So I go to my zip code. So now if I wanted to, and the zip code works here. Yes. This is one of the zip codes I always have memorized for California 90210.
I wonder why.
Yeah, I know. So this is a quick and easy one. You can also search it in the search geography name, either or. These are actually what are called ZICTAs, zip code tabulated areas. This is a census product. It's very, very similar to zip codes. I get confused with kind of like the explanation between zip code and ZICTA, but these essentially are ZICTAs. We just call them zip codes because that's terminology that people are used to.
All right. Someone asked if you could please go over again how to navigate to this mapping tool. I'm not sure if they mean AskCHIS Neighborhood Edition or creating a map.
Okay. So I'll just start off from the center homepage here. If you're on the Center for Health Policy Research homepage, for me, the easiest way is I just go our work programs California Health Interview Survey, access CHIS data. And now I have a different multitude of options here. Select on AskCHIS NE, take me directly to the AskCHIS NE tool. You see we have the get started, we have the tutorial is the very first, and then we kind of have this bar here, so you could create a map, and then it will load. I feel like that's the long route. To me, the easiest route to get to it is just type in AskCHIS NE on Google, and it'll show you the link straight to the AskCHIS NE site, and then it'll kind of like circumvent all that.
Using the any system, can you combine regions that are individually too small for data, but combined may have enough data to analyze? We have a few rural areas that alone can't be analyzed regionally via census tract nor zip code.
Yes. Yes. So the best way to go about that is go to your census tracts. So perfect example here. I'm hovering over this one. It's saying, hey, this is suppressed. Estimates are not available for populations below 1,000. So now what I can do is I'm just going to zoom into this tract here. I'm just going to select a couple of its neighboring tracts. I'm essentially going to create my own grouping. So I've essentially made a much larger tract with these tracts. And now I have an estimate of all of these tracts combined together with this tract that's unstable. So I think that's probably the best way you want to go about it. I know it can be difficult in these rural areas because, as you can see, the tracts become much larger, and that a lot of it has to do with the way that the census defines tracts. It's based off population. It's usually like 2,500 to like a 5,000 population, something to that extent. Some of these tracts, these far out rural areas, are very large. Like, I mean, some of them are larger than some counties, and it just has to do with the size of the population. Some other things that you might want to do is select your city. And I say this because you may see certain little cities in these spots. Like this is a perfect example, Big Pine. It's a really, really small area. So this is most likely one of the most densely populated areas in this whole tract that it's in. So you might want to consider using these little communities, these little cities that we've created small area estimates for, to essentially use this like kind of like a proxy for your tract that you're looking at. I think those, to me, those are some of the I'm kind of thinking if I was working in those areas and trying to figure out, hey, I want to do it on this specific tract here, but I'm not able to get an estimate for it. Look at that. Look at combining that tract that doesn't have, that has an unstable estimate or suppressed, and combine it with another tract to get something that'll get you close to it. And I think you can use that as a proxy. I think that'd be, it's not the best. It's not the best. I mean, preferably you'd want to have your own tract estimate, but there's some instances where it's just not going to work out. And so I think this is a good workaround for that, where you can say like, here's something, it's within the community that we're focused on.
And then similarly, someone asks if I wanted to create a grouping of zip codes that weren't touching, for example, a hospital service area with 14 attached and unattached zip codes, could I do that with this tool?
Yes, you can. So if I go to my zip codes, all it is, and this is where you're gonna want to do a control and click. So if I say I'm on this zip code here, 93634, I'm just going to click that one. And now it's just kind of pecking through and finding. I have an assumption that this request might be based off of, like, say, a county. So what I would do is I would if I was say, let's look at Humboldt. So I'm going to have it zoom into Humboldt County. So I have a quicker, a nice zoom in on Humboldt. And now I'm going to create a grouping of these. I'm going to do 4 zip codes that are not touching together. Their boundaries don't intersect or anything. They're all, I'm assuming this is all Humboldt County. It's pretty close to it. Now you can see that I've created that user-defined boundary. So it's, I think a lot of it is kind of like zoom to the area that you want. And then just, it's the lasso tool, the rectangle tool, or the oval tool, I wouldn't use. I would just, it's just a be patient with it and control and click and create that custom estimate that way. And this is something that you can do. You don't just have to do it with zip codes. This can be utilized with the counties, with the congressional districts, the state assembly, different legislative districts, cities, and the census tracts as well. But I think, census tracts, that seems very tedious because they're, as you're zoomed out, you can see some of them are really, really small, almost kind of like a pinpoint. But I think on these larger geographies like zip code and county, this would be how I would go about doing it.
Yeah. This is more of a forward-looking question. Typically, finding adult health data is possible through multiple sources, including AskCHIS NE. However, data on children and youth are very difficult to find, particularly if a school district does not issue a CHKS survey. Will the 2023 release of CHIS and subsequent release to AskCHIS NE include more needs data on youth ages 0 to 17?
That is a question more for our questionnaire team. I think that's a question that I'll forward out to our questionnaire team. I'm not privy to that. It's a good question.
And whoever asked that question, if you do want to email us, you can email that chis@ucla.edu, and someone will get back to you. When data is labeled as unstable, should we not be referencing it for policy work? We get this question a lot.
It's essentially do so at your own risk. There's ways around, like with AskCHIS and also AskCHIS NE, there's ways around the instability. With AskCHIS NE, it's essentially, I think a good way around that is just maybe group it. So if you have a census tract that has an unstable estimate, maybe group it with another one to get something that has more stability. With AskCHIS, the normal AskCHIS platform, if you have an unstable estimate, a good way around that is to pool your years together. That's assuming that the indicator that you're looking at has multiple years of data. If it has multiple years of data, you can combine those together, pull those out. pull those together. And a lot of times that can kind of whittle away the instability. And that also depends on if you're trying to do if you're trying to do a crosstab by race and ethnicity, and you're looking at very smaller groups, like say Native Hawaiian Pacific Islanders. Even if you pull data, you may need 5, 6, 7 years of data to get a stable estimate. It kind of depends on the population. So I think with regards to the reporting on unstable estimates, I think it's essentially we put out the flags. The estimates are unstable, but it's essentially it's kind of buyer beware is the best way I can say it. We do have tools that you can utilize to help mitigate the instability, and also just reach out to us with questions on that. Especially, feel free to reach out to me if there's any questions on that, especially with the AskCHIS platform, because I might be able to help with regards to help you out with anything with pooling data or whatnot, because sometimes it can be a little confusing and complicated.
Thank you. Would you please share what you referenced to regarding suppressing locations with less than 1,000 population? We have been using the Data De-Identification Guide by California Health and Human Services, which requires population to be over 20,000.
So that the suppression of the estimates, I think I'm not really familiar with the guide that you're referring to. I think one thing is that this isn't raw survey data that we're presenting here with AskCHIS Neighborhood Edition. These are modeled estimates. So I think there's a little bit of difference in that, whereas I think what you're referring to is kind of, I think it might be something with the raw thing. If you could send us an email at chis@ucla.edu, I have to take some time to wrap my head around that.
And then we did get some clarification from Todd Hughes, who's the director of CHIS, on the youth question. So data for youth ages 0 to 17 are available in AskCHIS. Additionally, in AskCHIS NE, some indicators are available for youth under age 18. See the options under Select an Indicator dropdown. We have a couple more questions, so if folks have questions, please use the Q&A function. We'll probably be wrapping up in about 5 or so minutes. Is there a way where we can see the questions asked for these results? And I will find that link right now and drop it in the chat. We do have all of the questions, the questionnaires and topics are all available online on the CHIS website. I don't know if you want to add anything to that, Jacob, but I'm just gonna copy that link.
Yeah, currently in the platform, it doesn't link to the specific CHIS question, but that is a good idea. I think that I might play around with actually having a link to it and saying, I don't know if we can have it specifically go straight to the survey instrument link, but I think having a little bit of information in, say, the tooltip, or hover over that says, say, this is CHIS question TA whatever. I think that's something that I can work to do. I think that is a good suggestion. Thank you.
Thank you. And we did drop that link in the chat. Can you really quickly go over what's available on the tutorial tab? Somebody asked about that as well.
So in the tutorial tab, it's just essentially just a quick walk over. These videos are about 5 minutes each on the process of creating your map. And essentially it's kind of going over all the stuff that I went through with selecting the geography, doing the address lookup, zooming in, creating custom geography grouping, etc. And then we have the create table. If you want more information, more kind of information on methodology and about, sorry. Go to the AskCHIS data. Read more about AskCHIS NE. Information on topics covered. As well as methodology, general information, data limitations and use, methodology brief, GIS information, FAQs, and then contact.
And then there's someone that asked that there will be a Q&A guide if we want to refer back to these questions on what was answered. We are recording this session. It will be posted to our trainings page as well as our YouTube channel for folks who do want to refer back. Some of these questions are actually available in the FAQ section of the website. If you do want a copy, please email us. You can email healthpolicy@ucla.edu, and we can send you the transcript for this event. Oh, we have one more question. Are there any tips for creating your search? I think someone's having some difficulty with the site loading.
So when you create your map, the main thing is let it load all the way up. And then I think it's just I think it all depends on like what geography you're kind of looking at, as well as like, are you focusing more on like health indicators, or do you just want sociodemographics? And then what year you're looking at. I think I don't know. I think that might be more of an issue with their browser and their system running.
Mm-hmm.
I think if anything, just make sure that everything loads up. Don't I think this is just my general practice with most web-based applications is don't rush it. Let everything kind of load up. If you see a spinning wheel, that's usually an indication for me like I need to stop clicking on everything and just let it all load.
Definitely. All right, well, that gets us through all of the questions. I just want to once again drop the link in the chat for the CHIS annual data release, which is happening on Thursday, October 3rd. This is just to save the date. We will be sending out flyers and more information about what we'll be going over in the coming weeks. So please email us if you have any questions. If you have any questions related to CHIS, you can just email chis@ucla.edu. And again, this event is being recorded and will be posted to our website in the coming weeks. Thank you so much, Jacob, and thanks to everyone for attending. Have a good rest of the day.
Appreciate your time, everybody.